liquid rhinoplasty is using injectables that we would normally use for other areas of the face, but we actually use them on the nose most of the time to try to avoid a surgical procedure. So when a patient initially arrives for the consultation, it's really important that we discuss exactly what their concerns are. There are some issues that are easily corrected by using injectables, but there are other issues that may not be easily corrected, or certain areas of the nose that we wouldn't want to inject. And so it's really important to have a very honest and frank discussion ahead of time so that everybody is aware of what we're able to achieve. Once we've decided to move forward, we try to use a filler that is very thin so that we reduce the risk of any complications, and then numb the patient topically. We apply a little cream to numb the area that we're going to inject, and use usually a blunt cannula, so something that's not sharp, and inject into the specific area. And we try not to inject a lot of volume at one time. So this may actually require multiple procedures staged over time, just to make sure that the changes that we're making are incremental instead of increasing the chance of any problems that might occur. On average, 6 to 9 months is what we would say, but the nose does not move significantly like other areas of the face do, and so oftentimes patients will get a year, maybe a year and a half out of their results.